Chandra. Are you there?
Yes,
No.
sir. Good afternoon,
Okay.
sir.
Please welcome. Uh, Dr. Chandra is professor and head of Department of Psychiatry in Ram Manohar Lohia Hospital. She is very illustrated and knowledgeable psychiatrist in the country. She works at an international level in a number of projects, and we are delighted to really have her. She has kindly agreed to come and talk to all of my audience, and her topic is suicide prevention, which is so very dear and so important to discuss with all of you. Dr. Chandra, please take over.
Thank you so much. I think there is some problem with the video. My video is on, but
Yeah,
uh,
yeah, I think that's what we are facing the video. If you can send it to me, I can play it from this side. But we faced
no,
it with the.
no, it is an interactive kind of free flowing talk. I have not put in PPT presentation, then it will
No, no,
become
no
very
problem. You
structured.
you go ahead as you like. That's
Yeah.
okay. That's
Yeah.
okay.
Thank you so much, sir, for the opportunity to contribute to school and adolescent mental health and also youth mental health. And suicide is such a sensitive issue. We are all grappled with it, whether we are clinicians or teachers or parents or society. Every stakeholder in the suicide prevention network wants suicide not to happen. Why is it such a problem for India? If we look into the global figures, 1 in 4 death in men and 1 in 3 death in women is by Indians. So Indians are contributing to 1 in 4 death for men and 1 in 3 death for women. In fact, 36% of deaths. So this is a huge number. And unlike in the West, we do have resources, but the resources are not evenly distributed. And the awareness about resources, awareness about mental health, what we call mental health literacy, is also limited. And hence, your initiative through the Mansik Shakti Foundations are uh, really appreciable and worth applauding because, in a very sensitive way, you're bringing to the forefront some very sensitive topics. Suicide is an act where the intention is to die. So, when there is completed suicide, there is very little we can do for the patient, but for the people who are left behind, the caregivers, the peers, the friends, the entire ecosystem of that person who committed suicide, they might need our long term help. At the same time, a lot of times we have people who uh, talk about committing suicide, people who might talk about getting means to commit suicide, people who might attempt a suicide, right? So, if somebody just has ideas about suicide, whether it might be passive, it's better if I die. It would be better if, God took me. इससे अच्छा है भगवान उठा ले, or active ideas that okay, let me attempt suicide in this manner, that is serious. It should not be taken lightly. And an attempt is a self-directed attempt, but it is non-fatal. And the intent has to be established. And a lot of time, once people survive, they try telling that it was an accident. And sometimes we miss the signs, and these people might attempt again. So it's very important to know that what may appear as an accident might have been a suicidal attempt. There are a lot of biological underpinnings, but I'll not be going into that. But we'll be talking about more about psychosocial underpinnings. I'll start first with myths. There are lots of myths about suicide, and like people who talk about suicide, people who attempt suicide never give any warning signs. पहले से पता नहीं चलता, suddenly attempt करते हैं, but it's not like that. A lot of times there are warning signs, but they are missed. Like one patient of mine who attempted suicide, he started giving away his precious articles like his tennis racket, his guitar, to his cousin, to his friends, and no, people thought he was being generous. Basically, he was preparing for his own suicide, but nobody connected the dots. Second myth is, if we somebody's talking about ending his own life, he's trying to gain attention. But most of the time, it is it's a call for help. It's a cry for help. It's not easy to talk in terms of trying to commit suicide. There's another myth that if we discuss suicide, it increases the likelihood. Hence, we should never talk about suicide. And that is very common in India, that most people, most families never talk about suicide, thinking it would enhance the risk of suicide, when the reverse is true. When there is a clear communication about suicide and why it's not the right option, why it should not be conceptualized, contemplated, that decreases the likelihood of committing suicide. If somebody decides to commit suicide, he cannot be stopped. So that's another myth. But in fact, if somebody decides to commit suicide, we get to know about it. Uh, Family members, counselors, mental health professionals, and the society at large can do a lot to prevent the suicide. There's another myth, like anybody who attempts suicide is a weak personality. That person is a coward. That person is selfish. He was only thinking about himself. He was not thinking about his family or friends. But it is not true. In fact, those who attempt suicide might perceive death as the only available option to overcome their distress. They are not trying to be selfish. They are not trying to be weak or cowardly. Another myth is, if somebody seeks help and shares problem, it will not help. But we know help seeking, mental health help seeking, talking about one's distressing issues, taking help of a counselor, a mental health professional, even on suicide prevention helplines or on telemanas, does help a lot of students clear their minds and get less stressed and less distressed. So, if these are the myths, then why doesn't everybody, not commit suicide? There are still people who do commit suicide. So there are certain risk factors and there are also certain protective factors. In India, most suicide by children and adolescents are by people who have not finished schools. So that is a very worrying trend, that, in schools, especially during the time for 10th class board exam results and 12th class results, a lot of students might attempt suicide. Another factor which is commonly seen the world over are family problems, relationship issues, social support, social isolation, lack of social support. We often see that for young children who might have nuclear families, both parents are working. There's lack of social communication at home. There's a lack of samvad at home. So the communication is very superficial, whether you have eaten, whether you have played sports, do you need a new gadget, but it's not about mental state of the child. It's not even about parental difficulties and struggles. So the child doesn't learn from the parents that how to overcome stress, how to deal with struggle, how to survive difficult times. So those are the skills which the parents should be teaching instead of only academic skills. And we, as children, you were given a lot of biographies to read, and the key point of discussion would be that the protagonist, the person about whom the biography is written, how did he overcome his challenges? And that kind of conversation is not happening, because now the focus is on learning. The focus is also on trying to get the maximum marks. um, a lot of students are actually not going to school and they're going only to coaching centers. So the talk about mental health takes a backseat when the children are part of a process which is churning out robots and not individuals who might have their own aspirations, desires, expectations of life. Other causes of suicide could be child abuse, interpersonal difficulties, lack of cultural uh, grounding, lack of spiritual grounding. So, a lot of children may not have the spiritual means and grounding to deal with stress. Yes, stressors can be dealt through a number of strategies. Some of the strategies are solution focused, trying to solve the cause of stress. But some of the strategies are also emotion focused, trying to deal with the emotions if the stressor cannot be wished away. And a very important aspect of dealing with stress is also having the spiritual strategies. And it's important that parents start inculcating spiritual grounding, spiritual beliefs, clear standards, so that when children are faced with stress, they have something to fall back on. At the same time, a lot of children might be having undiagnosed psychiatric illness, undiagnosed, untreated psychiatric illness from depression, schizophrenia, bipolar disorder, anxiety disorders, increasingly addiction, both substance use disorder and also internet addiction. Uh, and all these factors can also contribute to high suicidal rates. Children with impulsive tendencies can go ahead and do impulsive suicidal attempts over minor provocation. So it's very important to identify children who might have impulsivity in other fields, like during sports play, during class interactions, and have them get help for impulsivity. Let's not wait for the suicidal attempt to happen. Also, if there is history of suicide, whether in the family or a past suicidal attempt, it's very important that we are on an alert regarding this child if he or she starts exhibiting factors which might be associated with suicide. Um there are also websites and some literature where suicide might be shown as an honorable way. So it could be love story kind of romantic suicide. If the society is not agreeing, dying together might be an honorable option. So those kind of myths should be challenged and demolished, rather than asking the children, just don't visit those sites, don't think about it. We should not abort the opportunity for a realistic conversation. Children who have a purpose in life, whatever small purpose, big purpose, it might be a purpose to finish school or to get a job, or to get a certain kind of degree or to learn a certain skill. If you have a purpose, that is protective against suicide. Children who are generally able to cope well, or they have problem solving skills, they are at less risk for suicide. And the good thing is coping skills can be enhanced, problem solving skills can be taught. So one should not assume that if somebody doesn't have good coping skills or good problem solving skills, he is doomed. Nothing like that. All these things can be helped. uh, a person who is willing to seek help, that's essential, because a person who tells his family, his friends, his teachers, anybody that he needs help will probably get it, as compared to somebody who does not seek help, and others may or may not be able to identify his distress in time. People who have positive self esteem are able to manage their stressors better. People who pursue creative activities, hobbies, and sports, and engage with activities other than academics, are protected against suicide. Children who have good insight about their own strengths and weaknesses are able to address their weaknesses, focus on their strengths, and get ahead in life. At the same time, if the school environment is negative, there are teachers who are critical, there is lack of school family connect, excessive undue pressure on academics, those are the factors which can uh, contribute to suicide. Uh, on the other hand, if the environment is positive, there are supportive school teachers, supportive classmates, there is a positive connection between the school and the family members, then it is likely that the school will have a positive impact on a child's mental health. Some schools focus on social emotional learning. They have school counselors. They also focus on building key skills like resilience and communication for all children. So those children tend to become more empowered, even if they're academically not the very best. But in terms of emotionally, they are more resilient. And schools which support each student irrespective of his performance gives the child a sense of identity, that every child is valuable, and it's not only the high performers in academics, extracurriculars, who have meaningful existence. It's very important that we are able to give each child a sense of purpose, a sense of identity, a sense of belonging, and a sense of shared belonging. Families which have strong and healthy bonds and stable, secure environment uh, ha- have less likelihood of suicide. Uh, if the family has effective conflict resolution practices, that if case there's a conflict, let's say between parents or between two father and uncle, uh, if the child observes that there are peaceful ways, there are logical ways, there are respectful ways of managing conflict, those children are empowered. If, on the other hand, if the parents neglect or abuse a child, if there's death in the family, especially death of parent or a close one, uh, if there is criticism or bullying by family members with unrealistic expectations, uh, if the parents want to control every aspect of a child's life, then children are more likely to feel despondent. Having said that, the amount of competition that is there in India, uh, the lack of um the lack of enough options for all the children makes everybody insecure. And we know that the children who have done well in their school and college academics get you know an get a good start in life, and children who have done less well in school and colleges, they struggle. Doesn't mean that they will not come up, but their struggle would be far more than the children who have done well academically in board exams and college. And hence parents tend to focus a lot on formal exams. So that is also the reality of the country. One cannot just blame the parents for being focused on academics, because it's a very thin line between success and long term struggle in India. So we have to accept that. uh, in terms of society, if there are strong social support networks, we know that even places where the social support networks are strong, because of stigma, the person who attempts suicide or his family may not get the social support that they require. If we can reduce the access to suicidal modes and means, then yes, we can have less incidence of suicide. If there is access to mental health care, and now there's a lot of access to digital mental health care and telephonic mental health care, so it's important that whatever avenues are available, they should be utilized. um, Many a times family members and school teachers, they ask, how should we recognize that this student might be at risk? So if somebody starts giving statements like things will never get better, there is no point in trying, I'm a failure, nothing will work out, uh, as I said in an earlier example, starts giving away his precious objects, if people start saying nobody can help me, I cannot see a way out, I'm worthless, I'm useless, I'm not good enough, I'm not important. And sometimes he might be echoing what the family members might have said, that you are worthless and you are useless. So those kind of statements should ring a bell, that the child might be facing some hopelessness, helplessness, worthlessness. Sometimes children and adolescents start making statements like, I'm a burden on others. I'm ashamed of myself. And that could also be an echo of what the family members might have said, that you are a burden, tum sab pe bojh ho, तुम्हें अपने पे शर्म आनी चाहिए. So when we say all these statements, we should realize that the child is absorbing those statements, and it has an impact long after the statements are said. If children start saying that I'm worried, I'm sad all the time, I don't know how to feel happy anymore, I don't know how to stop this, yes, you should view it with concern, seek help. If the children start withdrawing from friends, family, cousins, neighbors, classmates, they become forgetful or restless in class, absent minded. Suddenly, they might go into, sudden spurts of anger or crying or anxiety, changes in sleep, appetite. You should focus on getting mental health support. If children start telling that they do not enjoy what they enjoyed earlier from watching tvs or playing online games or playing sports, uh, they start uh, their performance in school and coaching institutes, and other areas of life, it starts declining. You should be a little worried that why the child who was doing so well for so long, what has happened, what has happened to this child. Instead of just telling that you are not studying anymore, you are you are not doing well, we are spending so much of money on you, and what are you doing, it's time to to seriously contemplate what is happening to the child, seriously introspect what has gone wrong, uh, set some time aside, talk to the child, and try to figure out. And sometimes it's difficult to figure out alone. So, because, like one student asked in the last session, how to talk to the parents. Children, now there is so much of barrier between the parents and the children. Children sometimes don't know how to talk to the parents, and parents don't know how to talk to the children. Best to get a mental health and wellness kind of professional in between to seize the issue and to address the issue. um, NCRT has come up with Umeed guidelines, and the words are very nice: understand, motivate, manage, empathize, empower, develop. And these are guidelines for schools. And I think they've come from Ministry of Education, Government of India. But I think they are good for colleges also, because finally every child matters. If we look into how to prevent suicide, uh, we should also look into the role of addiction in suicide, because a lot of time children might be taking addiction for self-soothing. They are worried, they are restless, they are sad, or they might also be taking for novelty seeking. It's something new, and they might attempt something. And apart from substance addiction, in internet addiction also, it's a very slippery slope. And there were some games, online games some time back, which encourage children to attempt self-harm behavior. So we have to be very vigilant about that. So regarding suicide prevention, I'll go from global to local. um, United Nations has viewed suicide seriously. Mental wellness is part of their Sustainable Development Goal (SDG 3), and they have attempted to understand and the mechanisms of suicide and try to reduce it. So World Health Organization, they came up with four key interventions for suicide prevention. For the first was restricting access to means for suicide. So try not to have pesticides at home. Try not to have firearm at home. So if we restrict the means to suicide, then suicide rates decline. Also working with the media so that there is responsible reporting of suicide cases and sensitive reporting of suicide cases, so that the suicide is not sensationalized, it is not dramatized. Um, the third aspect that WHO stressed was on was to help young people with life skills to cope with various stresses of life. So, life skills training is also very important in early identification of people who may be suicidal and keeping contact with them in short term and longer term to ensure that they do not attempt. So the entire approach is very nicely, they have an acronym called live life. So the live thing is leadership, which every person should take, not just the school authorities or family authorities. Each person is a leader in himself. And it also stands for multi-sectoral collaboration, because it takes a village to bring up a child. It takes many stakeholders to help a child on road to recovery. Uh, Evidence-based interventions for implementation. So that is the I. The V is the vision for innovation, vision for delivery platforms. Dr. Amresh Srivastava sir must be congratulated that his Mansik Shakti Foundation is doing a tremendous work in awareness building. There's also an app which can help children, screen themselves and also seek help. Then to have evaluation system, surveillance system, and research. And the live life, the LIFE is less means for committing suicide, interaction for responsible media reporting, help the young form their life skills, formulate, and early identification, management, and very important follow up. Because after an acute event, when the patient appears fine, that is also the time that he might also realize that he's less under surveillance, less under scrutiny, and he may attempt again. Regarding Government of India, we came up with National Mental Health Policy in 2014, which focused on creating awareness and destigmatizing mental health issues. It also focused on addressing discrimination and exclusion due to stigma for mental disorders, addressing substance use, establishing CICs, crisis intervention centers and helplines, responsible media reporting, uh, monitoring mental health of the population, and the impact of mental health program. Finally, the government has actively looked into restricting access to means of suicide. Like in a city like Delhi, kerosene may not be available at all. A lot of restricted chemicals which might have some industrial usage may not be available for domestic sales. Then we had the Mental Health Care Act in 2017. This act, in a path breaking initiative, it decriminalized suicide. Earlier, the 309 section of Indian Penal Code made suicide punishable with 1 year imprisonment or fine or both. But now under section 115 of MSCA, there is no punishment for a person who attempts suicide. In fact, there is a provision to help people and provide mental health support and treatment for anybody who has attempted suicide. Amongst various national programs of Ministry of Health and Family Welfare, we have the National Mental Health Program, and it has this district mental health program, which my previous speaker from Ayodhya, Dr. Kumar, had talked about. And this program also has a lot of manuals. A lot of work has gone into it so that the standard of care is similar across the country, which is so diverse. So it is not that in metropolitans the program will develop better, in remote corners it will not develop. There are manuals for medical officers, for social workers, for psychologists, for district level activities. So government has taken 360-degree approach regarding providing mental health to the community. There is also a provision for providing mental health support and psychosocial support during disaster and emergencies. At the same time, Ayushman Bharat health and wellness centers and Pradhan Mantri Jan Arogya Yojana are also focused on providing mental health care and support, including device-based neuromodulation. Other programs of the Government of India like Rashtriya Bal Swasthya Karikram and Rashtriya Kishore Swasthya Karikram, while they are were earlier limited to general health, nutrition, injuries, now mental health and substance use is also a very important component of these programs. Ministry of Health also has School Health Ambassador Initiative, the Nasha Mukti Abhiyan, the Nasha Mukti Campus Abhiyan. Those are also important to address suicide in at a macro level, percolating down to minor level. So, um, in line with WHO CRO's strategy on suicide prevention, it was decided by National Suicide Prevention Strategy to reduce suicide by 10% by 2030, and we are already ending 2025. So it came up with an important four-pronged approach for suicide prevention by reinforcing leadership and institutional responsibility, capacity building, enhancing the capacity of health services, developing community resilience and societal support programs, and strengthening surveillance. So the REDS um, acronym delineates government's four-pronged strategy, and it shows the government is serious about suicide prevention, but the stigma and lack of communication between different stakeholders makes suicide prevention a challenge. And after suicide attempt, prevention of a repeat attempt, that is also challenging. There are programs about having a suicide registry in 4 southern states under Samast flagship program. There is also provision for telephonic counseling, because a lot of times after an attempt, person might not be in a position to go for mental health support counseling periodically, or mental health support counseling may not be available. And we also have Telemanas, which is free to use, and it also provides mental health support counseling. So while there is a multi-sectoral approach at the macro level, at the national level, the implementation has to be done at the ground level. Um, and government comes up with priorities, but we have to see how best to address. And in the last segment, there was a school principal who said that from Delhi, a government school principal who said that they have established some mechanisms for some counselors in his school. I would say that even if there is no counselor in the school, ideally by law there should be. If they were not, uh, teachers can themselves be sensitive about the emotional needs of the students, and there should be at least some period, some 20 minutes, in which there is no academics, there is no extracurricular, in which there's only conversation in the class. I had a student uh, whose complaint was, which the teacher had written, was that he sees out of the window and doesn't answer, and the teacher considered that child to be arrogant. And the father brought the child to me, and I looked at the teacher's complaint and I said, what happened? So he says, no, since after the summer vacations, the child is not doing well. The note had specified that, and he's just looking out of the window. And when I talked to uh, the child was not opening up. And then I started to talk to the father. So the father said, please help me. I have to go to work every day. Now the child is also bringing complaint letters from school. How can I manage so much? And I said, where is the mother? And both child and the father, and now this is a 7 8 year old child, and the father must be around 35 36, both started crying. Actually, the child had lost his mother during the summer vacations, and the child was in grief, and the father was also in grief. and it was just the father and the son in Delhi. The rest of the family was in their native village, and they were both trying to cope up with this sudden and tremendous loss. And no wonder the child was not interested in whatever is happening in the class. So I asked the father, "Didn't you tell the teacher that the child has lost his mother?" And the father said, "The first day after school, where I accompanied the child, I told the teacher, I told the principal, don't scold my child. He has just lost his mother, and be a little supportive." But when there are 50 and 60 students in the class, I'm not defending the teacher, but she might have forgotten. She was definitely not concerned. She went to the extent of writing a complaint note about him, but did not talk to the child. And when I started talking to the child literally, hugged me and said, "Mummy chali gayi." Well, he was started outpouring his grief. This is a very small child. Yes, this is not a case for attempting suicide, but it shows that our school systems and college systems can become so impersonal. And then I collaborate with premier institutions, and one of my collaborators was also warden of the hostel. This is an engineering college setup, and a student committed suicide. And the principal asked the warden what happened, and the warden obviously didn't know because there's no conversation. So the focus is that you maintain, the targets, you maintain the performance, but what the person or the individual is going through, his life stresses. Sometimes we don't even get to know because we are not having a conversation. We are not having any realistic conversation. So it's also a time for us to introspect that how are we leading our lives? Are we also going in a limbo and we are just doing our job, go to class, teach students, come back home, correct copies? If this is so mechanical, maybe this whole process, which is very, I should not use that word, but it is apathetic, uh, is the apathy contributing to suicide in some way, that children and adolescents don't feel confident about approaching anybody. So we must look into those aspects as well. um, at the end, I would say suicide is a tragedy beyond the tragedy. The impact of suicide percolates for nearly a generation after the suicide attempt. It percolates to family, friends, teachers. If any teacher has lost a student to suicide, she'll never forget the child. It's not that teachers are unconcerned, but maybe our school and college systems are such that the platform for realistic conversation, bonding, is just not available because we are putting our children through a rat race. So, with these, I'll end my talk, and I'm open to any questions or queries.
Thank you, Dr. Chandras, for such a candid and vivid description of suicide behavior and what is the situation in our country, all the rules, bylaws, and the government's efforts, particularly, which is highly commendable. Thank you very much. I highly appreciate your participation and giving us time from your busy schedule. I know how busy you are, and it's your really concern about our foundation and the subject that you are here. Now, without wasting time, I would invite if there is any question from our audience. I'm sure there may be many. To please come forward and ask the question. Yes, Mrs. Singh has a question. Can you please ask your question? Go ahead.
Hello, Dr. Meena
Call.
Chandra.
Yes.
I have heard a lot about you from my mother, and I'm grateful today I got the chance to talk up with you. So, my
Thank you,
question,
Akansha.
okay, ma'am. Ma'am, I am struggling how to talk to my parents about how I feel when they bring up my mistakes I made during my adolescence. Uh, every person has a past, but these reminders often comes up, especially when I am feeling happy or positive, and they then make me feel judged. Sometimes even drive thoughts of self harm.
Okay, so one of the casualties of 21st century or late 20th century is the art of conversation. And many people lack the art of conversation. If a child has made mistakes in childhood or adolescence, bringing it up at, the wrong time, bringing it up repeatedly, bringing it up when it clearly makes the child feel uncomfortable or embarrassed, that's not good conversation skills. If the parents feel that some aspect of your mistakes need an addressal today, uh, they can have a conversation which is qualitatively different than judgmental remarks. So maybe you and your parents can seek help of a mental health support person or counselor or a mental health professional to address these difficulties in attitudes, in conversation, in being judgmental, rigidities, you know, expectations or expectations not being met. So, all those underlying issues should be addressed. Otherwise, these conversations will continue and they'll make both parties more bitter. And that is not what we want from life, irrespective of whatever has happened in the past. We don't want bitterness to, perpetuate. So I think you and your parents should seek help.
Ma'am, I think my parents feel like if I'm talking about counselor, they think I'm in depression or something.
Yes, so awareness about mental health is less. But just because there is no awareness doesn't mean that it should not be addressed. Nobody knew about COVID, but people learned about COVID because they needed to know about the personal protective mechanisms, the preventive mechanisms to survive. So if we can learn about COVID in a short span of time, we can also learn about mental health support, how important it is. We can learn. One should not give up. You should ask your parents and yourself, or at least one parent, to collectively meet a counselor and start that journey for healing for both parties. Healing for both parties.
Okay, thank you so much, ma'am.
Thank you.
Thank you. Is there any other question that we need to address? Please come forward. It's a very important topic that she has discussed. It's a burning topic for all of us, matter of great concern. Now, Dr. Chandra, one thing which bothers me is number of students who attempt suicide, go to hospital and return to the college. Their life remains very stressed because of stigma, attitude of people, and really the institutions need a plan to do something about it. Do you have any comments?
Yes, it is a double-edged sword. Sometimes students who have mental health issues or who might attempt suicide might not inform the school system or the college system for fear of stigma, for fear of being judged. And it might be rightly so that they might get judged. At the same time, I find that education institutions are not prepared to address the issue, to address the elephant in the room. So there was a question in the chat box about students attempting suicide in Delhi and Agra and Jaipur, and we had a suicide some days back, last month, in Delhi, a very prominent case where some school teachers have been suspended. Uh, so those are reactionary interventions. But that you suspend a teacher, it runs through media, and the students do demonstrations. But there is no conversation about preventing suicide, about addressing suicidal attempt, about increasing sensitivity of the teachers, of the peers, so that suicide doesn't happen, for about having a session for children to ventilate. So, disclosures here, when I was in 12th standard, one of my classmates who was, perhaps caught cheating or perhaps not caught cheating, but he was prevented from giving rest of his, first semester exams, and humiliated and all that, and he did suicide. So, as an adolescent, I have gone through that. But sad to say, after many decades, the schools become very defensive whenever there is a suicide or an attempted suicide. The media becomes very, media tries to put the blame, a media trial onto the school, though there might be many factors, right? So it is a complex issue. Schools should be prepared to talk, in general. Let's say they might have been suicide in another city, but it's a good, uh, you know uh, it's a good starting point to start a conversation for suicide for children who are a little older, let's say 9, 10th, 11th, 12th. Why wait for something to happen in your school? If something is reported in media, start a conversation. You'll be surprised how sensitive children are. The children might have their own opinions about what was right, what was not right, what should be done, how they would want, these issues to be assessed, tackled. So it is time that we start hearing the most important stakeholder, which is the student.
Mm. I think you're right, and I think the at institutional level they need some policy to have change in the curriculum or how to receive a person who had gone through severe depression or an attempt of suicide. It's not uncommon, and as we know, about 13,000 students die due to suicide every year in our country. And experts say that this data is underreported. In fact, it's 5 to 6 times from this number. International studies do confirm that. If that is the case, we are in serious trouble. And as I pointed out in the beginning, India is the country where suicide rate is rising, and rest of the world the suicide rate is declining.
Falling.
So this really bothers. What is lying ahead? 5 years, 10 years, 20 years. And it is happening because of social complexity, the change in the environment, the kind of challenges the students face, the kind of support, loss of support that they have. They're losing friends in their life. There is no one to talk to. They are losing confidence of the family that you will not succeed. There is a lot of peer pressure, parent pressure. I think all these pressures need to go, because the price will with families and the society will pay for the suicide is far too greater than the achievement which one might get by putting pressure on our students. So with this,
Uh,
thank you very much, Dr. Chandra.
I would like to bring in one more point, if I may.
Yes, please,
I
please.
I think it's time that schools also introspect what they are delivering. So schools have started becoming institutions. Schools and colleges are becoming institutions to deliver academic excellence, m- marks, achievers, but they are not very supportive of children who are struggling, whether they are struggling with physical illness. We have seen that with children who have tuberculosis, with children who have renal failure, who are on dialysis. The standard response of the schools is, you withdraw your child from our school. They don't want to deal with a child who has cardiac issues. They don't want to deal with a child who might have diabetes. So they are looking at, these picture postcard perfect children who
Mm,
deliver only excellence, as if rest of the children do not exists, and if somebody doesn't meet their you know their checklist, then they sometimes schools do their best to force the parents to withdraw. And it is time that they start introspecting. Are you trying to give to the nation one well developed citizen? Are you trying to have holistic development of all children? Or you are yourself, the school itself is in a rat race for maximum number of CBSE 90 percentiles and this and that and grade point excellence. So what is the school trying to do? If the school were to become a little bit more sensitive that these are the children who are human beings, who are at certain stage of development, and they might have physical challenges, health challenges, mental health challenges, social and economic challenges, and how best to support them sensitively, then I think a lot of these suicides might be mitigated if the schools change their perspective. The perspective is so driven for only materialistic success that anybody who is facing issues, and not just students, even teachers who face issues, teachers who have burnout, feel very excluded from the school processes. And a survey has been done by the NCRT for teachers across the country, and teachers are also reporting burnout. So I
Yeah.
think it is time that the schools themselves introspect and see what are they trying to deliver, what is their aim to the society, what is their contribution. I think that will address a lot of these issues holistically.
Yeah, you're right. And let me share with you that chief of educational institution are very careless across the world. When
Mm,
we reviewed while setting up a college mental health program, the
mm,
first barrier is attitude of one who is chief of the institution. The second
mm.
barrier is the it percolates the other members of the administration. Like in India, let me tell you, we have MOU for screening with 10 different universities. The one which has not followed and did nothing is the institution in Kota.
Okay. Yeah.
The second institution which promised to do something and backed out is again from Kota. So the if the attitude of institution head can be changed, and they are very close quarters, they see their work very narrow, very focused, and that is determined by academic excellence. They are very few institutions are there who are interested in personality development, stress management, building on resilience, and positive psychiatry, and so on and so forth. What they don't realize, despite having evidence that if there is anything which stands between a student and his or her success, it is the mental health. Your student may be brightest of the bright. He may be in the best of the best university in the world, but if his mental health is poor, if his mental strength is poor, he or she is not going to get where they deserve to be there. So it's a important issue, but I think the onus lies more on teaching institution and society rather than parents, I would say. And I hope people look at it from agenda of health and education mixed rather than only one R. And that's the way forward it should be. And if people do decide not to do anything, I'm sure the consequences, unfortunately, are going to be grave. Thank you, Dr. Chandra, that coming and talking so important topic. Thanks a lot. I much appreciate your help.
Thank you
Oh,
so much, sir.
yeah,
Thank you for the opportunity.
thank, thank you. Now, this is